Jentadueto is a combination of two medications, Linagliptin and Metformin. It is used with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. Controlling high blood sugar helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Linagliptin works by increasing levels of natural substances called incretins, which help to control blood sugar by increasing insulin release, especially after a meal, and decreasing the amount of sugar your liver makes. Metformin works by helping to restore your body's proper response to the insulin you naturally produce, and it also decreases the amount of sugar that your liver makes and that your stomach/intestines absorb. It is important to take Jentadueto as prescribed by your healthcare provider. The typical starting dose is 1 tablet taken twice daily with meals. Your healthcare provider will adjust the dose based on your blood sugar levels. It is best to take Jentadueto at the same time each day to maintain consistent blood sugar control. Before you start taking Jentadueto, be sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily with meals. It's important to drink plenty of fluids unless otherwise directed by your doctor. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Take this medication regularly at the same times each day to get the most benefit from it. Follow the medication treatment plan, meal plan, and exercise program your doctor has recommended. Tell your doctor if your condition does not improve or if it worsens. Some common side effects include nausea, vomiting, stomach upset, diarrhea, or a metallic taste in the mouth. If any of these effects persist or worsen, inform your doctor or pharmacist right away. If stomach symptoms return after taking the same dose for several days or weeks, notify your doctor immediately as it could be a sign of lactic acidosis. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as joint pain, unusual skin blisters, or signs of heart failure like shortness of breath, swelling ankles/feet, unusual tiredness, or sudden weight gain. Seek medical help if you have symptoms of disease of the pancreas, such as nausea/vomiting that doesn't stop, or severe stomach/abdominal pain that may spread to the back. While this medication does not usually cause low blood sugar, hypoglycemia, it may occur if taken with other diabetes medications or if you do not consume enough calories from food. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's important to carry glucose tablets or gel and to eat regular meals to prevent low blood sugar. If you miss a meal, check with your doctor or pharmacist to find out what you should do. If you experience symptoms of high blood sugar, hyperglycemia, such as increased thirst/urination, inform your doctor right away. Your doctor may need to adjust your diabetes medication, exercise program, or diet. In the rare event of a serious allergic reaction, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. It's important to be aware that taking too much metformin, which is a component of Jentadueto, can lead to a serious condition called lactic acidosis. This is more likely to occur in older adults, those with kidney or liver disease, dehydration, heart failure, heavy alcohol use, those undergoing surgery, those having X-ray or scanning procedures using iodinated contrast, or those using certain drugs. If you experience symptoms of lactic acidosis such as unusual tiredness, dizziness, severe drowsiness, chills, blue or cold skin, muscle pain, fast or difficult breathing, slow or irregular heartbeat, or stomach pain with nausea, vomiting, or diarrhea, it's important to stop taking Jentadueto and seek medical help immediately. For some conditions, your doctor may advise you to temporarily stop taking this medication. Be sure to consult your doctor or pharmacist for more details on the appropriate use of Jentadueto. Remember to take your medication as directed by your healthcare provider and don't hesitate to ask them about the best time to take Jentadueto for your specific needs. Before taking Jentadueto, it's important to talk to your doctor or pharmacist if you have any allergies to Linagliptin or Metformin, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your healthcare provider. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, breathing problems, liver disease, pancreatitis, gallstones, or blood problems. Additionally, if you are planning to have surgery or any X-ray/scanning procedure using iodinated contrast, it's important to inform your doctor about all the medications and products you use. When taking Jentadueto, be aware that it may cause side effects such as blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar. It's important to avoid driving or using machinery until you are sure you can do so safely. Limit alcohol consumption while taking this medication, as it can increase the risk of developing lactic acidosis, pancreatitis, and low blood sugar. Additionally, be cautious of factors that may cause dehydration and increase the risk of lactic acidosis, such as high fever, water pills, excessive sweating, diarrhea, or vomiting. If you experience prolonged diarrhea or vomiting, it's important to stop taking Jentadueto and consult your doctor. It's also important to stay hydrated unless your doctor instructs otherwise. During periods of stress, such as fever, infection, injury, or surgery, it may be harder to control your blood sugar. In these situations, it's important to consult your doctor as it may require a change in your treatment plan or medications. For older adults, they may be more sensitive to the side effects of this medication, especially low blood sugar or lactic acidosis. If you are a woman of childbearing age, it's important to consult your doctor or pharmacist about the use of reliable birth control while using this medication, as it can cause changes in the menstrual cycle and increase the risk of becoming pregnant. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also important to discuss a plan with your doctor for managing your blood sugar while pregnant, as pregnancy may cause or worsen diabetes. For breastfeeding mothers, it's important to consult your doctor before breastfeeding, as metformin passes into breast milk and it's unknown if linagliptin passes into breast milk. It's important to be aware of potential drug interactions that may affect how Jentadueto works or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Beta-blocker medications, like metoprolol and propranolol, may prevent the fast or pounding heartbeat you usually feel when your blood sugar falls too low. Other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. There are many other medications that can affect your blood sugar, making it harder to control. Before making any changes to your medication, talk with your doctor or pharmacist about how it may affect your blood sugar. It's also important to regularly check your blood sugar levels and share the results with your doctor. If you experience symptoms of high or low blood sugar, let your doctor know right away. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Additionally, there are other medications that can affect how Jentadueto works in your body. One example is rifampin. So, it's important to discuss any other medications you are taking with your doctor or pharmacist. If someone has taken too much Jentadueto and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. An overdose of Jentadueto can lead to a condition called lactic acidosis, which can cause symptoms such as severe drowsiness, severe nausea, vomiting, diarrhea, rapid breathing, and a slow or irregular heartbeat. It's important to seek immediate medical assistance if you suspect an overdose. Remember, it's important not to share this medication with others. It's a good idea to attend a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. Make sure you know the symptoms of high and low blood sugar and how to treat low blood sugar. Checking your blood sugar regularly as directed is also important. Before you start taking Jentadueto, and while you are taking it, you should have lab and/or medical tests done, such as kidney function, liver function, blood sugar, hemoglobin A1C, and complete blood counts. It's important to keep all of your medical and lab appointments. Be sure to consult your doctor for more details. If you happen to forget to take a dose of Jentadueto, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your usual time. It's important not to take a double dose to make up for the missed one. As always, if you have any concerns or questions about your medication, be sure to consult your healthcare provider. When storing Jentadueto, make sure to keep it at room temperature and away from light and moisture. It's important to keep it out of reach of children and pets, and avoid storing it in the bathroom. When it comes to disposing of the medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, you should properly discard the product and it is expired or no longer needed. If you're unsure about the proper way to dispose of Jentadueto, be sure to consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.